struggle with chronic hip flexor stiffness and pain, I'm going to try to convince you in this video that things like yoga and Pilates, stretching and core work is not the answer to your problem. I want to tell you about a very common problem that exists with active individuals who struggle with chronic anterior hip pain. But before I do this, let's dive into some hip anatomy. It can be helpful to remember that the pelvis is surrounded by a ring of muscles on the front, back, and sides. For optimal movement at the hip, there needs to be muscle balance throughout this ring. When balance is present, the ball of the hip should spin backwards in socket when the hip bends and forward in socket when the hip extends. A really common imbalance that exists in people who have persistent issues with aching and tightness in the front of their hips is that they tend to get really tight and overactive deep glute muscles on the back of the hip, and then over lengthened and weak in the deep muscles that sit on the front of the hip. When this happens, there's a tug of war where the muscles on the back side of the hip win, which causes that femur to drive excessively forward during these movements. In the physical therapy world, this movement imbalance is called femoral anterior glide syndrome. When this anterior or forward glide happens excessively over and over again with daily movement and exercise, soft tissues on the front of the hip eventually start talking to you through the symptoms of stiffness and pain in this region. The solution to this problem is not to stretch this stiffness away, but rather to restore balance around the deep muscular ring that surrounds the pelvis. Poses in yoga and Pilates that place your leg in extreme positions of extension behind the body may feel like they're hitting the right spot. They may feel like a good deep stretch that may even help temporarily. But remember, these positions are driving the faulty movement pattern that's causing your issue in the first place. More often than not, people with stiffness on the front of their hip will need to work on opening the muscles on the back of the hip to prevent excessive gripping and tightness in the deep glute muscles that shove the femur further forward in socket during these movements. What about doing yoga and Pilates exercises that help strengthen your core? Will this help restore balance around your hip and pelvis? That really depends on how you perform the core exercise. Exercises that require you to keep your legs fully extended and suspended in the air while bracing with the core will absolutely feed into this issue of excessive anterior glide of the femur and socket, leading to further irritation on the front of the hip. In those with anterior hip pain and stiffness, these core movements will require excessive use of larger superficial upper thigh muscles that will further pull the femur forward in socket. To have optimal centering of the hip joint during core work, the legs need to be in contact with the ground or you need to shorten your lever by bending your knees and moving very slowly through your core work in order to give the deeper muscles of the hip a chance to work and stabilize the joint. If you struggle with popping and clicking in your hip during core work, focusing on these things should help with these symptoms. If you do feel your hip start to pop as you lower or lift your leg, try bracing through the core a little bit more, or try reducing your range of motion. The ultimate goal is to have no popping or clicking at the hips when you do this. This will ensure that you're using the deepest parts of your core and hip to stabilize during the motion.
If you know of anyone who struggles with chronic stiffness in their hips, please make sure to share this video and subscribe to my channel to see more videos like this.